So now we're looking at the radial nerve. Currently we're approximately halfway up the humerus, and the radial nerve is right around the spiral groove in this location. On the left is our brachialis muscle, and on the right, or laterally, is our triceps muscle. And as we follow the nerve more distally, we can see that nerve coming out of the spiral groove and the beginning of the brachioradialis muscle coming in. And the brachioradialis continues to get larger as we're moving more distally towards the elbow. So when we're looking at blocking the brachioradialis branch, it's harder to see the specific branch itself, but typically the textbook describes that we want to be 3 finger breadths proximal to the lateral epicondyle. So the lateral epicondyle is here, and this location is 3 finger breadths proximal. So here we can see both the brachioradialis muscle and the brachialis muscle. It's really important, again, to use stimulation of the nerve here, because this, you can't really distinguish the branch to brachioradialis just visually. And we want to be sure that we're not stimulating the radial nerve proper, because then if we did a block, we would cause wrist and finger drop. So when you are stimulating this nerve, you want to have just elbow flexion and not wrist or finger extension. Additionally, following your nerve block, you do not want sensory disturbance, because that means you blocked more of the radial nerve proper. So again, just watching the nerve moving proximally back into the spiral groove. And then as we move distally again, that brachioradialis muscle is just starting to emerge here. And if you're ever having trouble locating the radial nerve, I generally recommend going up to the spiral groove location, or another option is having the patient's forearm slightly supinated and looking in the antecubital fossa for this view of the humerus, where you have the 3 prominences. And then if you're in this position, you look laterally and you can find the bright radial nerve in the fascia there and follow it more proximally up the arm to locate it, again, approximately where we'd want to be doing the injection. The view is slightly different here because the patient's now supinated, so if I pronate them again, we're back to the view we had seen previously of the brachioradialis and the brachialis and the radial nerve in between, approximately 3 centimeters or 3 finger breadths proximal to the lateral epicondyle, where we would stimulate and do our nerve block for brachioradialis. In terms of finding the radial nerve branch to brachialis, that is much harder to do because it has such a small course after it leaves the radial nerve that it's hard to see on ultrasound. But you could consider going up near the spiral groove before the brachioradialis muscle is readily visible and blocking just distal to that, and again looking for brachialis contraction. Typically, blocks in the spiral groove themselves are less comfortable, and so we try to avoid that. So when doing this injection, you could realistically come either way, but I think that the medial to lateral approach is much easier here. We're lateral enough that there are no blood vessels in the region. Again, doing in plane, approximate 45-degree angle, reaching that radial nerve. If you were to come lateral to medial, you would move your probe position to bring that radial nerve close to the edge, and a less ideal angle to come in plane, but you can still make it work.